You're listening to another soundbite edition of the Physio Matters Podcast, brought to you by IFOMPT 2016. This interview is with the 6th keynote speaker, Professor Nadine Foster from Keele University, who is a physiotherapist and extensively published academic in the field of stratified care and its integration into clinical practice. Me and Nadine had this conversation back when the project first started, which was about 18 months ago now, so forgive the references to IFOMPT 2016 being a million miles away. We're now almost within 100 days of the conference. This is just a snippet from the 20-minute chat, so get to ifomptconference.org to get the full version. The fact that IFOMPT 2016 has decided on the slogan "Expanding Horizons" suggests an ever-changing clinical landscape, but what changes do you feel have been most noticeable in recent years?
In the UK, certainly, I would say that there's been a real increase in focus and emphasis on providing data upon which to design and deliver clinical services. So I suppose that's been very helpful for me as a researcher to see, if you like, the health services also now really begin to use good data in deciding on how best to configure and deliver health services, including physiotherapy. So I think there's been a real increase in the push for evidence to underpin practice, a real drive to collect patient outcome data in everyday clinical practice that can then be used for auditing and review purposes, and of course in England commissioning of services, and an unprecedented rise, I think, in emphasis around particularly things like cost effectiveness, which we did talk about years ago, but definitely more recently we're seeing real evidence of cost-effective data helping to drive services, and I think that's been a real sea change in the last 5 to 10 years.
Okay, and looking at some of your earlier work, there was it's become more and more popular, shall we say, to consider the biopsychosocial aspects of people suffering, particularly when it comes to some of the chronic pathologies that you've been involved in researching. Do you feel that there is a gap between the evidence that is out there and clinical practice in your experience?
I think most clinicians completely get the fact that patients are complex, and that when you're dealing with common pain problems, you're not just dealing with pain and disability, but you're dealing with the whole patient and everything they bring to the experience of that pain condition. And I think clinicians have known that ever since they started treating patients. I think what's different more recently is that we're now beginning to be more systematic about which other factors we know are important. We've got better evidence upon which to drive our clinical assessment processes and the particular factors and domains we're looking for. The big hitters, as I might call them. So in the language of stratified care, I guess I would call these as sort of the key and independent predictive factors that are going to help us understand which patients will do well and which patients won't do well over time. And that new knowledge is really helping the biopsychosocial model come to life, because it now is able to equip clinicians with simple to use tools like the Start Back tool and others that help busy clinicians in everyday practice identify not just the biomedical or biological factors, but also the psychological and social factors that are going on with their patients. And I think that's been a real paradigm shift, a real step forward, because all clinicians need simple to use tools with patients in order to help them actually operationalize the biopsychosocial model.
Lovely. And in terms of, you mentioned large-scale RCTs that your group is well known for. However, it has been known that the RCT might not suit the physiotherapy profession, particularly in MSK, where pathologies are, shall we say, vague in some ways. Would you say you agree with that or understand that premise, or do you feel that there is a shift now that we have improved our research methods? So that was Professor Nadine Foster, our 6th keynote speaker to come on the IFOMPT Media Podcast with Physio Matters. Yet another cheeky cliffhanger for the YouTube channel. Get it full podcast at ifomptconference.org. Looking forward to catching up with Lorimer Mosley, who is the 7th of 7, which will make it the full house, ready for July for IFOMPT 2016. Amazing how all these topics have developed even since we conducted these interviews. Haven't chatted to Lorimer yet, so that one will certainly be current. So if we haven't hooked you already and you haven't got yourself signed up, let me just remind you what you are missing out on. So our podcast to date have been with Roger Kerry, Jeremy Lewis, Nadine Foster, Harriet Wittink, Anina Schmid and Joel Bialowski. And we're just about to conduct the seventh, being, again, Lorimer Mosley. A lot of big names alongside the, of course, bigger roster that follows. So if you haven't checked it out already, ifompconference.org, get yourself registered, have a little look. Certainly a great event and a great value event as well. So I'm looking forward to meeting hopefully a lot of you there. But until then, you've been listening to IFOMPT Media by Physio Matters, discussing Physio Matters because Physio Matters. Bye for now.